Hello everybody, my name is Lukas Reinecke from the University of Applied Science Osnabrück. Today I would like to present to you our study in which we have investigated which factors explain the perceived degree of disease self-management support of diabetes apps. Diabetes mellitus is a non-communicable metabolic disease affecting high, intermediate and low-income countries, reflected by the high prevalence rates and forecasts predicting increasing prevalence rates for the upcoming years. You can see it in the chart. Diabetes will remain a significant challenge for the societies and health systems worldwide. Well-managed blood glucose levels strongly depend not only on the medical therapy, but also on the behavior of the patients themselves. This embraces regular physical activity, an adapted balanced diet, achieving and maintaining a normal body weight. These insights were bundled by the concept of self-management, which is defined as coping with everyday life with a disease. Diabetes apps can support the disease self-management with different functions like documenting relevant data, blood glucose monitoring, insulin administration, calculating values, providing access to communities, giving advice, gaming, and activities for children. The apps appear to be particularly helpful with regard to the disease self-management by raising awareness of behavioral complications, and thus increasing the self-competence of diabetic patients. Assuming that apps are of utility in terms of disease self-management, theoretical frameworks predicting the perceived usefulness of these apps seem to be promising. One of the most known frameworks is the Technology Acceptance Model, TAM, which has been expanded to TAM2, including social and cognitive variables. Because of this expansion, we decided on the TAM2. The main target variable for applying TAM in quantitative models was whether the disease management app was intended to be used, which corresponds with the classic TAM approach. Several qualitative or mixed method studies also employed TAM to investigate barriers and facilitators of app use for self-care. But however, the studies focusing more explicitly on self-management as the dependent variable were exploratory and didn't use quantitative methods to test hypotheses. Against this background, the study aims to further investigate what circumstances contributed to perceiving an app as a beneficial tool for self-management. It therefore addresses the following research questions. A. How well can a TAM2 model explain the variance of perceived disease self-management as a major benefit of using an app? And B. Which TAM2 variables contribute to such an explanation model? A TAM2 informed hypothesis model was developed to explain the degree of self-management support provided by diabetes apps that includes the TAM2 variables. You can see it on the left side: subjective norm, image, relevance to everyday life, outcome quality, experience, perceived ease of use, and perceived usefulness. Furthermore, the model was supplemented by the variable app classification and complemented by demographic variables. I have divided our method into 4 blocks. The first block, operationalization. In this model, relevance addresses everyday life, not the job. Voluntariness was combined with subjective norm, and output quality and results demonstrability were combined to outcome quality. App classification was determined whether the app was mainly used as a diary or measurement repository, or whether it served as a system providing active advice in terms of nutrition, therapy, or any other interventions. The second block, questionnaire. The model was operationalized and implemented in an online questionnaire realized in Lime Survey. In order to check the validity and the technical implementation, a pretest was carried out among a representative group of participants, different age and profession, diabetics with and without handicaps. The final questionnaire contained a total of 37 items, out of which 27 items were used in this analysis. The third block, data collection. Participants were recruited via email, Facebook and forums and addressed members of various major German diabetes support groups, interest groups and user groups of app providers. Data were collected from end of August to early November 2020. The fourth block, data analysis. Only the complete and meaningful data were used in the analysis. To calculate the model, it was also necessary to code the categorical variables, app classification, diabetes type, gender and age using dummy variables. Multiple linear regression was used to test the hypothesis model. To check the model, assumptions, linearity, normal distribution of the residuals, independence of the residuals, homoscedasticity and multi-collinearity were tested. Here you can see the descriptive statistics of all significant variables of our study. For your understanding, the respective items of the variables self-management, relevance to everyday life, outcome quality, perceived usefulness, image and perceived ease to use were rated on a scale from 0 to 10. Subjective norm was defined as the sum of 4 items on a scale of 0 to 6. And for experience, the participants had to state their daily usage in minutes. The predictors included in the regression model explain 59.2% of the variance in the perceived level of support for diabetes self-management by the app use. Out of the 10.2 informed variables, subjective norm, relevance to everyday life, outcome quality and perceived usefulness became significant, showing that the higher these factors were, the better they supported the perceived degree of disease self-management. In case of subjective norm with a negative coefficient, the association was different, and the more pressure there was, the less was the app perceived as a help for self-management. Also, the type of the app played a significant role. Apps with a diary and measurement storage functions were superior to apps with nutrition, therapy and intervention device concerning self-management. Neither the demographics nor experience, image and perceived easy to use were associated with better or worse perceived support of the app for managing the disease. The result of 59.2% indicate the general usefulness of a TAM2 guided approach to model app use for perceived diabetes self-management. The predictors, relevance to everyday life, outcome quality, and perceived usefulness determine the degree to whether an app is perceived as a good tool for self-management. This can be called the relevance usefulness quality complex. Apps predominantly serving as diary and measurement apps were preferably regarded as useful self-management tools, contrasting advice apps. While the first type of apps offer features that the patient themselves control, the latter type of apps tend to act as an external instance imposing information on the app users. We have some limitations. The study investigated the perceived degree of self-management, not an objective measure of self-management behavior. So there is no information on how well the participants managed their disease. Furthermore, classifying an app either as primarily supporting diary and measurement repository functions or the nutrition, therapy support and exercise advice features was not easy because many apps had mixed functionality. However, 2 persons performed the classification based on an existing scheme. All in all, the present study makes a contribution to the scientific discussion by suggesting factors that are particularly associated with self-management. It hereby raises the question, should app self-management mean self-control? Thank you for listening, and it would be a pleasure if you visit our homepage, which you can access with a QR code.